Really official today.
Yeah, we look very official.
Yeah.
I know Warren stepped out. He'll be right back, but we have a quorum, so we will call this meeting to order. Thank you all very much for being here today. It is now 1:17 to be official. And again, thank you all so very much for being here. Our first order, I'd like to ask Ms. Leanne Franklin, who's Director of our Spiritual Services here, to please lead us in the invocation. And if you'd please join me with the pledge of the allegiance, I'd appreciate it very much. Leanne.
Thank you. It's always such a privilege to be in this room. Each month I come, I think there's so much going on, but every month there is so much going on, so much to celebrate. You all know this, but with the delirium survey passing last week and the commissioners approving our budget and, so many good things happening. And so this morning, JR sent me a quote this morning about how we're conflating what is urgent and what is important. It's like we can't make the distinction anymore. Everything seems urgent. But here's what I'm grateful for, because what I see in the board and in our leadership is it's not about what's urgent, it's not about what's important, but y'all have a sense for what's essential, and that guides every action every day. So with that, let us pray. We gather together grateful for these people, for the leadership you have put in place that helps guide us to the future and keeps us firmly grounded in the present. We thank you for your wisdom, for your courage and compassion that helps us to know moment to moment what is essential, what is most important for the communities we serve. And so this afternoon, we ask for your wisdom to continue to guide us, for your passion to enliven us, for your creative spirit to help inspire us into the future you're calling us to, for your mission to ground us, and for your love to fill us and surround us, and to be with each and every person of all the communities we serve. In your holy name we pray. Amen.
Amen. Leanne, thank you very much.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Is GK here today?
No.
Good. Good, okay. Thanks everyone. I think the next item on the agenda is item number 3. I've been advised there is no one wishing to speak, which will take us to item number 4, which is the approval of the August 9th minutes, which have been provided previously. Should there be no comments or recommended changes, I'd entertain a motion. Have a motion by Dr. Weber, a second by Mr. Montgomery. All those in favor say aye. Thank you very much. Takes us to item number 5, and I'm just going to make this brief. We've got a lot of stuff to cover today, and there's so many things going on, as Leanne referred to in her comments. But there's one thing I'm going to stop a moment. It came up at last month's, and the man next to me on the right on the left, I have to tell you that he doesn't like to brag, and he's about to tell you, oh, this is no big deal. But I had the pleasure of witnessing Robert receive from the Studer Group, and we all know they're one of the huge international consulting along with their parent company. But Robert received what was called the actual Hall of Fame Award for hospitals and management, and I know he's going to say the entire team deserves that. I heard his speech that morning at 8:15 in Nashville, and I have to tell you, he talked about the team, he talked about the mission, he talked about a lot of things about this hospital. At the end of the day, the award goes to him as a Hall of Fame. Now, I did not know that much about this award. This award is not given out just to everyone in the length of the organization, of their international. There was probably 2,000 people at this convention, but at the end of the day, there's only been less than 50 people receive this award. So again, on behalf, Robert, to you, the board, many of them asked me, I know Ralph, you asked about, we knew you were getting this award. You were pretty sneaky about it. You didn't say much because it came up the last board meeting. I found out about the last minute and personally wanted to be there. And so again, I just want to let you know, and I was there on behalf of the board, but congratulations for the award well received. So thank you, Robert.
could have gotten in my car and driven
Yeah.
up with me. I would have taken you.
Yeah, well, again, I think, and.
You wouldn't have got him in
Yeah, you wouldn't got him in the jet. But again, Robert, again, so many times you're always talking about, and yes, across the entire team, so many great things are happening at JPS, but obviously as leader, congratulations on the award. I heard you say it's not important, it's very important, so congratulations. The next order of business, again, I'm going to go ahead, Robert, if you wouldn't mind, a lot of things happening. I'm going to turn to you for your update, your CEO report.
Sure. I want to, for those of you that did not get a flu shot, we have flu shots available. And for all of you here at the table that may not have realized we were giving flu shots today, you can go down. We've got a special table for Mr. Petty to get his flu shot.
Good luck getting there.
And we wish you the very best. I know. So you can get a flu shot on the plane with me. But there is a few things, speaking, Charlie, Mr. Powell, I appreciate your kind words. The brochures that y'all have at the board table, and some of you may have out in the audience, there are three graphic designs, and our communications team won these national awards. The card, the brochures that you see in front of you were submitted at a national conference, the Graphic Design of the USA, and our communications team brought those awards back. Diana, did we get total of 4 or total of 3? 3, that's what I thought. Diana Brodeur, I want you to stand up real quick, representing the Communications Department. They did a wonderful job, and I'm greatly appreciative. The other thing that I want to make known to you all, if you have not heard or seen, we have brought on our new executive director of the foundation, Kristen Sullivan. Kristen will start her first day. She's not, y'all look around, she's not here yet. Her first day will be Monday. But Kristen has joined the team, and we're very excited. She started out her career at the Fort Worth Star-Telegram. After leaving the Fort Worth Star-Telegram, she went to the University of Texas at Arlington and headed up their development campaign there. She left UTA after her successful stint there and went to the READ program. The READ program was committed by the Fort Worth ISD, the city of Fort Worth, and Mr. Matt Rose and Mr. Rainwater. And they put a great program together to try to enhance our reading programs throughout not only Fort Worth but Tarrant County. She headed up that program, and we were lucky enough to bring her on to our foundation. And I'm very excited about her being a part of our organization, and I think she'll bring a huge attribute to her. And I think that you all as board members will appreciate her efforts in the community, and we'll bring her before the board and introduce her to you when she starts. She's already, we had a foundation board meeting that Mr. Wynn and Mr. Powell attended, and she came to that prior to her even starting, which we're appreciative of. But I think that'll be great. Leanne mentioned in her comments about the ability to celebrate. I think it's time for you as a board to celebrate, because Mr. Petty, if you'll remember, when we set out to try to create destination metrics, one of the destination metrics that we most challenged with was what you do in geriatrics. We knew that there was a significant role JPS should play in geriatrics care. And what we try to do is take that large term of geriatrics and define it. If you want to be a leader in geriatrics, what does that mean? What level and what portion of geriatrics do you deal with? So the Joint Commission has a certified program in delirium in geriatrics care. And we asked the Joint Commission to come in and review us and see that if we were even able and in line for a certification for delirium and geriatrics care. They came in and gave us quite the scrutiny, looked at us, reviewed us, and when the surveyor, although we have not gotten our official letter, when the surveyor left, the surveyor assured us that we would be the only second hospital in the United States to get that certification. There is only one other, and that's Hackensack in New Jersey. So that adds to our constant list of certifications, from stroke to sepsis to AMI to level 1 trauma. You as board members should have a lot to be proud of. And if you look back at that dedication to our destination metrics, when people talk about mission and drive and where are you going and what are you doing, you all as a board set that for this organization. And that's, I think, an accomplishment on y'all's part and an accomplishment on the geriatrics team and overall the JPS team. So I'm very proud of them to do that, to be the only second hospital to do that. And if you now combine that with all of our other certifications, we are the only public hospital to have 5 major certifications of that magnitude. So I'm very proud of this team and all that we've done. So, Mr. Chair, I know that we've got some time issues and we've got some things for folks that are going to be making presentations that have airplanes to catch and other things, but that's all that I have from the CEO report.
Super. Robert, thank you again. Thanks. Congratulations to you and the staff. That's fantastic. Item number 7, thank you very much. I will call Dr. Schrader up.
All right,
Chad,
so
anything?
we do have 3 items on the agenda for privilege consideration. Before we get to that, just a very, very quick thank you to administration, board, staff. We had earlier this month 2 different town halls with our providers. You're going to hear a lot more about physician engagement. And we are set to go to the Southeast Medical Clinic on the 20th to meet with providers as well. But one of the things we were able to reveal was a physician lounge in an area just across from the Sky Bridge. So as a thank you to the board on behalf of the medical staff and as a thank you to Mr. Early and really the entire team, it very much is appreciated. So now with that, there are 3 different items I need in terms of consideration for privileges.
Okay, we would address item number 7A. Any comments you have reference to that, Dr. Schrader?
No, this is essentially a clarification in terms and an update in our orthopedic surgery privilege card. Nothing of concern.
And the board received prior. If there's any discussion, we'd take it now. If not, I'd entertain a motion. Have a motion by Dr. Weber, second by Mrs. DeBose. All those in favor say aye. Aye. Which takes us to 7B. And Chad, is there anything there you need to mention? Again, I know everyone was provided a copy.
So the quick version is for physician assistants. Typically, anesthesia works with CRNAs in the operating room. There's going to be a need, both 7B and 7C, tied to allowing APPs to help work in the hospital environment. So this pertains specifically to the physician assistants.
Okay. Have a motion? Have a motion by Dr. Weber, second by Mr. Montgomery. All those in favor say aye. Aye. And the last one, Dr. Schrader?
Part C.
Very similar.
So nurse practitioner
Right.
privilege card for that same anesthesia environment.
Any discussion? I'd entertain a motion. Have a motion by Mr. Wynn, second by Mr. DeBose. All those in favor say aye. Aye. Opposed, no. Thank you very much. Chad, anything else?
No, sir. Appreciate
Thank you.
everything.
Thank you so very much. We will then move to item number 8. Dr. Hotchberg, Michael, I know he's back there. There he is. Good afternoon. That's right. I think you said last month this is going to be your first one up, so it's all yours.
First one.
All right.
So I just have a, whoa. Now you see why they don't allow me up here. I don't understand how to use a microphone. So just like a couple of comments. So over the last several months, since joining, as I've really begun to alter the dialogue from what acclaim the medical group means to a why of the delivery mechanism, really in recognizing that as a global clinical enterprise, the old silos of care are dinosaurs, really verging on the extinct. I've really spent a great deal of time speaking to our providers and trying to foster a network of empowerment, one where they really feel like owners in partnership with our nursing and operational leadership. Several weeks ago, we held our first think tank task force, which was made up of frontline physicians and APPs, designed to find solutions rather than state where issues lie. In our Women's and Infant Service line, we'll be piloting a growth and strategy committee led by our faculty and meant to serve as an advisory team to the service line chief, lending guidance on evidence-based practices, academic initiatives, research opportunities, and recruitment. Growth, in my perspective, is as much about the individual becoming a better provider as it really is about defining what the community needs are. And considering the prominence of the APPs in our clinical practices, we are developing multiple forums in which to foster advocacy. One such initiative is the development of a lead APP role on the acclaim side, someone who can help lend wisdom and insight into how best to align the team. We have recently successfully completed our recruitment for a director of CMS Innovations and Value-Based Care and 2 executive medical directors, one of population health management and the other inpatient integration. Collectively, these 3 positions represent our acknowledgement and pressing need on the provider side to create, refine, and implement a unified acclaim and physician enterprise strategy around care coordination, utilization, such as provider variance, and healthy outcomes. And I really do want to stress the word outcomes, as this is really an area where we're continuing to refine our focus. I have asked our service line leaders specifically to ask the fundamental question of whether our interventions clinically impact and improve lives. By illustration, we average about 50 to 60 patients a month who undergo non-traumatic lower extremity amputations. That's 600 patients a year, the consequence of which exponentially grows as one considers quality-adjusted life years, loss of social productivity, and further utilization of health services. The question is not whether the amputation was appropriate, but rather what led to the patient eventually requiring the amputation. By reverse engineering the process, it is my hope that we will unearth a series of steps and data points that will ultimately lead to an enhanced environment of care. Since the N of 50 to 60 cases per month is relatively narrow enough to allow us to map out the multifactorial reasons why, from patient access to communication to service offerings. Ultimately, the goal here is larger, though. My hope is that once we have a clear and thoughtful comprehension of how to reverse engineer, we will be able to utilize this same process to other care conditions throughout the organization. Finally, I would just add, on the consent agenda, you will find recommendations and approval for 4 board members. Dr. Brian Ming, Dr. Van Johnson, Dr. Richard Fulkerson, and Dr. Stephanie Carson-Henderson. In addition, Dr. Paul Bella, who is one of the positions that is coming off the board, who has served admirably as our chair of the physician board, and I really do want to thank him for all his efforts. In replacement, Dr. Jocelyn Z will become the chair of the Physician Board of Directors for Acclaim, and I am really excited and thankful that she accepted that and look forward to partnering with her. I have nothing else to report and would be open to any questions.
Michael, thank you. Any questions for Dr. Hoffman? It's all a quiet group. Michael, thank you very much. We'll look forward to this next month also. Thank you for your update. Which brings us to the committee reports. Item number 9. First up is Finance. Steve.
Thank you, Mr. Chairman. We had a Finance Committee meeting on August 23rd to review the July financials, and Ms. Clark is here to address that if anyone has any questions. We also have a number of contracts on a consent, one of which, at the appropriate time, I'm going to pull off for open consideration.
Okay. All right. Ms. Clark.
Hi, good afternoon.
Afternoon.
So kind of a quick highlight from what we covered in detail at Finance Committee earlier. If you can see it, there's a lot of numbers, but you have a copy on your portal as well. If you look at our operating margin for the month of July, you can see that we were very close as a combined entity. We were actually about less than $100,000 away from our budget for the month. However, there were some large intercompany transactions that happened between the hospital and Acclaim, where the hospital actually incurred an expense that showed up as revenue over an Acclaim. So these transactions were intercompany, and also what created the variance to budget. The medical center had an unfavorable variance, and Acclaim was able to have a favorable variance this month. So overall, you can see that the bottom line, we actually came out on at $927,000 compared to a budget of about $550,000. Year to date, I can't draw a circle around that one. year-to-date, we are at $8 million loss as a system and 7.7 budget. So we've got about $1 million gap there still. And this is the financials, just as a reminder, for the first 10 months of our fiscal year. We'll be closing our fiscal year on September 30. Is there any questions that I can answer today?
Any questions for Sharon? Also want to thank Sharon and Steve. I know you attended and several board members were there. She's also made several presentations to the county commissioners and as they approve their budget also. So I know Finance Committee, Steve, and staff's been very busy, so I appreciate all the work you did in there. Any other questions for Sharon? If not, I would ask, I guess that's really a report. We won't need, do we need approval of those, Neil? Yeah, then we'll just take those as a report if there's no questions. Sharon, thank you very much. That would then take us down, Roger's out, would take us down to quality. Chuck, any updates from the Quality Committee?
There are two policies in the consent agenda. The first is the pain management policy. The second is the sexual assault nurse examination services policy. A recommendation was made to the staff to not use the term best practice when talking about services, but use evidence-based as a more common language.
Right.
There were 4 presentations, and I would encourage the board members to go and look at them because they were quite good. One was on the stroke program, one was on the sepsis process program, one was on the medical emergency team MET. I cannot recall the numbers involved, but I think every board member ought to look there and see exactly how effective this MET team has been in identifying patients that are sort of teetering in the hospital and getting them to the appropriate level of care. And then the last one was nurse staffing effectiveness. Wanda presented that. It was quite good.
Yes, it was.
That's it.
Good deal. Any questions for Chuck or anything in the quality? I know many of you attended that quality meeting, and again, Wanda, thanks for the presentation. And it's nice to hear all the good things happening. So again, Chuck, anything else? Quality? Thank y'all very much. We'll go to item number 10A. Consider approval of the reappointment of Scott Rule to the City of Euless TIS Board. So, Shirley, anything?
No,
Get Scott
Scott
something
is
to do.
pretty much our representative on all of our TIF boards. And since he's not here at the meeting today, I think it's very appropriate we appoint him.
Bonnie, why he's not here? He's on several of them. There being no other discussion, I entertain a motion.
I move.
I have a motion by Reverend Emerson, second by Mr. Montgomery. All those in favor say aye. Tell Scott, congratulations. Proposed bond package, the protocol, Robert, I know it's been on the portal and package. Is there anything you need to add?
The only thing I would say about this is very important to us as staff, and I hope that you as board members will take this very seriously. We've had this before. Neil's going to comment on it in a second, but this is really when you are, particularly with any potential activity, not only regarding a bond package, but anything else, to have outside influence is always going to help protect you and help us as staff members not get into discussions that may be challenging or difficult, or you may have a situation where you feel awkward at, and you may not even realize, or the vendor may not even realize they're having those discussions with you. So we want you to look really closely at this as to what you can and cannot do, and how you should make sure that you follow a process by communicating to Scott. And I'll let Neil talk about the legal side of it and why we've done this.
Board members, this is the same protocol you adopted a couple of years ago. And again, as Robert said, it applies to board members and all staff members of the hospital district. If anybody gets any inquiries regarding anything that might you might think would be related to something coming out of the bond program, all those calls and comments need to be referred immediately to Scott Rule, and his phone number is indicated in this protocol, which will be posted on the website. That keeps everybody following the same process. It provides not only some legal protections, but it's a fairness situation too for everyone involved, so that there's one vehicle, one process, one contact. So, Mr. Chairman, I recommend that the board adopt this as their protocol as it relates to anything remotely connected with the bond election and anything emanating out of that.
Based on that discussion and advice, is there any other discussion for the board prior to being entertaining a motion? There being none, then I'd entertain a motion. Dr. Stevens, I have a motion. Second by Dr. Weber. All those in favor say aye. I wanted to, until you fit. Did you have a question, Ralph?
I have a comment, but I'll wait.
You sure? The only, I'm sorry, I missed it. The question I've got is that Scott Rule, I was out in a function the other day. I know many of you people come up to you now if there's discussion of the bond package. He's not here today, but Mr. G.K. Manus made several presentations to this board. He likewise has made himself available to all board members, foundation board members, to keep us up to date on what is happening with the bond package. But I was at a function and you just had people come up to you about the bond package, and I got so tired of saying call Scott Rule, I actually had to memorize Scott's cell number. So I was at a meeting here, I think at Quality, and I have a stack of Scott Rule's cards now in my car. So every time I go to a function, I just put a bunch of his cards in my pocket. So when I'm asked, I just say, contact Scott Rule. So if you need to do that, Scott's getting a lot of calls. I'm sorry, but or hopefully he is. So anyway, so thank y'all very much. Then the next item will be item number 10C, terms and conditions sale or purchase. I think you had all this information in your file. Kathleen?
Good afternoon, everyone.
Hey.
I have 3 contracts before you today, and the first one is for Varian Medical Systems. Actually, all 3 are for the same company, but we'll start with the first one.
Please.
It's for a purchase of a second linear accelerator for our cancer clinic. It's for $3.5 million, and it will help us because of a number of issues. Our current unit was built or installed in 2005. It's 13 and a half years old, and we're running about 7,000, close to 7,000 visits on that unit. The downtime has been tremendous with that unit this year, and we really need a second unit to help us with downtime, help us with our growing volume. And also with this new unit, it reduces the radiation doses and the time for the procedures. So we have the ability to probably increase the capacity and efficiency on those units. It will be interfaced with the existing planning system and EMR within the cancer center, and it also meets all the regulatory requirements for archiving. It's a great need for our organization at this point in time.
Kathleen, would you do me a favor, and would you give the board members an understanding as to why this is coming to full board and not the finance committee because of the issues of the timing of this? If you would expand upon that, it'd be
It is
helpful.
a capital purchase for this year, and working with the vendor, they gave us a great discount if we can fast track this to the end of their fiscal year, which is September 30th. But also, it took us a great length of time to get everything through the legal review process and all of the work that needed to be done in order to expedite this for this fiscal year.
So it's a need by which we're also saving money if we meet this timeframe.
Well, and it al-
Correct. We
and
can
also-
save a great deal of money by meeting the deadline.
Yes.
It also ties back into the lease agreement on the relocation.
Correct. That's the
and
other
so
piece of it.
those timeframes line up, so.
It's
needed
180
to.
days to build, and if we approve it at this point in time, we can have it ready for January for the install. Well, it's 180 days for manufacturing and installation, so we can be ready for the April estimated time for the new cancer center.
All those pluses plus save money.
Yes.
Any more discussion for Kathleen in reference to this item? If not, I entertain a motion. I have a motion by Mr. Montgomery, second by Reverend Emerson. All those in favor say aye. Thank you very much. Kathleen, if you'd take item number D.
The second contract is also with Varian Medical Systems, and at the time we were discussing the purchase of the current of the new unit, we actually asked about upgrading the current unit so that it could have some residual value for us and also work as a backup if we do have the opportunity to put in a second unit. So this is an upgrade which will reduce radiation exposure and also improve treatment times for patients. It basically replaces the, if you want to use the term, guts of the system and brings it up to newer technology. And it will definitely help us with the backup for the volumes that they're putting through that department. This is a $378,000 purchase, and it is in the capital for FY18.
Right.
This has not only a consideration approval of this agreement, but it also has an exception to the bid policy.
Correct.
Because of the tie-in to the current equipment.
Based on that discussion, any other questions? Yes, Ralph, go ahead.
So this unit, I was asking myself, I was gonna ask her earlier, this unit, the upgrade now gives us basically 2 solid units.
It should, yes.
And give you a backup.
Yeah. So one doesn't have to work at all.
Correct. And also, if one is under a preventive maintenance time frame, or if it does go down for any reason, we don't have to cancel patients and send them out or delay any treatment for patients, which is a satisfaction for patient and also improvement for their treatment.
Would that, at some point, would there have been an option of upgrading versus purchase? If, let's just say if unit goes down, we need to purchase. Cost be greater than this.
If you could ask that again, please?
We're upgrading the unit.
The first unit, yes, the current.
But what if it went out and we need to purchase? Cost be greater.
It would be a lot higher cost.
Much.
So we have additional capacity.
Right, this will help us with
Routes
capacity.
forward.
And don't forget the safety issue of reducing radiation exposure and also treatment time for the patients. It's all around a better process for the program.
Good. So additional capacity, backup, and we're saving. Good. Ralph, any other questions? If not, I entertain a motion. I have a motion by Reverend Emerson, second by Mr. Montgomery. All those in favor say aye. Thank you very much. And Kathleen, if you'd go ahead and take item number E.
And I forgot to tell you that we went out for RFP on all 3 of these contracts. So this contract, the third one, is for the, what we're doing is we're bringing contracts forward for service at the time we're purchasing the actual capital equipment. By doing that, we get better pricing up front. So in this case, we will be bringing that contract forward next month, but this is a service contract for the existing unit. It's for $296,558 per year for a total price of just over $1.4 million over the life of the contract. It does give us the ability to delete the contract with a notice period if we choose to eliminate the use of that first unit down the road.
All of this did not.
Yeah.
This is just the one unit. I'll be bringing the new unit forward next month.
Any questions? Excuse me, DT, do you have another question? Sure, okay. Any other questions for Kathleen? If not, I entertain a motion. I have a motion by Mr. Wynn, second by Dr. Weber. All those in favor say aye. Opposed, no. Item carries. Kathleen, thank you very much.
Thank you.
You got those all approved. Brings us to item number 10F, approval of the resolution authorizing the amendment of the JPS pension plan. I think Mrs. Walker Pia is going to come up for that. And Mr. Adams, like any other questions, I think you're going to answer. Okay. You got it. Piece this. Good afternoon, Pia.
Good afternoon, everyone.
Good afternoon.
Thank you all for allowing for me to present today in reference to the resolution for the amendment of the JPS pension plan. The resolution that we are asking for is currently from the 1% to 2% increase for employees. So at this time, what I do ask is for your approval of this amendment.
The amendment and the resolution were posted on your website. This is also part of the budget that you approved. This was taken into account in the budget.
I would comment at this point that on behalf of myself and the staff and everybody else, I want to thank this board and the boards that were previously in place for the kind of pension program that we have. solid nature of this pension program is one that I think many hospitals in the nation would envy. And that's because of the conservative nature of this board and the boards that have preceded it. And I appreciate that. It's a strong pension plan, and it's well-deserved, and that is due to this board and the policies that have been set by finance chairs, including a bunch of them that are on this committee, including the current one.
Dorothy, any questions or anything? Is there any questions? Have a motion for approval by Reverend Emerson. Have a second by Mrs. DeBose. All those in favor say aye.
Thank you.
Opposed? Yeah, thank you so very much. Item number G is a lengthy one. You can read it there, but it comes down between, it's another contract. And Ms. Costa, there she is. Good afternoon.
Good afternoon, nice to see you. I'm here to talk about a new piece of software from Epic. It's part of
Is
the...
that mic on, Melinda?
Green,
Not really.
coming on.
Kind of blinking red and green. Can you hear me?
Yeah, there you go. Switch that mic out.
Yeah.
Yeah, we'll go with you.
Of course, of course. No, that's much better. Thank you. To talk about a piece of software that's fairly new from Epic. It's part of the Epic package that we would be adding to our Epic contract called Secure Chat. As I'm sure you're aware, physicians, as they're taking care of patients, often have to talk to each other and frequently do that in a text mode. What this piece of software does is allow for that communication among the physicians about a patient's condition and what the next step might be to happen in an encrypted, HIPAA-compliant way so that it is safe communication.
Doctor to doctor.
Doctor to doctor and eventually doctor to nurse as well.
Does
Very
it
detailed.
have audit trail, just in case you need to review them? Does it have audit
Sorry,
trail
DJ.
for later on, for later use? Does it keep a copy of it so that for audit trail purposes down the road?
Yes, yes, and should they choose, it could be added to the EMR as part of the documentation about that patient.
Good.
Can I assume that they pass high trust in SOX 2 compliance and all that stuff?
Yes, that's exactly why we're adding this, so it will follow those rules.
Good.
I have a quick comment on line 2, under action. It's supposed to be Epic. There's a misspell on the,
I know.
Oh.
Thank you for pointing that out. We did see it.
Point made, good point, DD. Any other questions for Melinda in this? Neil, do you have a comment
Yeah,
relative to
again,
the?
this is, board members, this is going to be, you're voting for the agreement as well as the fact that it's an exception to bidding.
Okay. They'll give you handled in one approval.
One approval.
Okay. I have a motion by Mr. Montgomery, a second by Mr. Wynn. All those in favor say aye. Opposed, no. Melinda,
you.
thank you very, very much.
Thank you.
This would take us down to the consent agenda. I think, Mr. Montgomery, you mentioned there was an item you'd like to be pulled prior to the
Sir,
vote.
I'd like to remove item 11A from the consent to be considered separately.
Okay. 11A will be removed from consent. We discuss that before we go to close or after?
We can do it right now.
Okay. You want us to go ahead and discuss that at this?
Well, I'd go ahead and take care of your consent.
All right, then let's go ahead and take the consent. If that's the only one being removed, Wanda, I'll have you come up right after, but if there's no other additions or removals, I'd entertain a motion to go ahead and approve the consent agenda with the removal of item number 11A. I have a motion by Trent, second by Mr. Wynn. All those in favor say aye. Consent agenda passes. We will now deal with item number 11A. Ms. Peoples?
Thank you.
Thank you.
I presented this original contract at the Finance Committee, but we are bringing it now to the full board. In reviewing it, one last time, we realized that one of the essential components, the pulse oximeter probes, were inadvertently left off the contract, and that is a critical component for these defibrillators. These are a replacement for all of our current fleet of defibrillators throughout the network. And our current ones have exceeded their life expectancy, and we can no longer get batteries for them. So it's essential that we replace them. However, the pulse oximeter probe sensors were left off. There's a lot of components on these defibrillators, and it was just an oversight. So it does result in an additional $80,000. So rather than trying to take it back through finance and since we're at the end of the fiscal year, we're asking to bring it to the full board for consideration. So the new amount that I'm asking for at this point is $1,573,050.
So everything else is identical? Everything else is identical to the contract with the addition of $80,000, because obviously we need them to work.
$80,000.
$80,000, correct.
80,000,
There's
which,
no other changes in the contract other than
No other
the
changes?
amount.
Okay.
yeah, other than describe what that 80,000's been for.
Correct. And if the board would so consider that as part of this contract, so I know you had that previously presented to you with this additional $80,000 today. If that be the desire of the board, I'd entertain a motion. Have a motion by Dr. Weber, second by Mrs. DeBost. All those in favor say aye. Opposed, no. Wanda, thank you very much
Thank you,
for doing that. Steve had to step out, and we'll so advise him of that. Thank you, Edith, for that. Which would take us all the way down to item number 12, which is legal counsel report. Mr. Adamson, anything there?
Under our process in terms of contracts that were negotiated this past month, under 200,000, there were 27 of those, and those that were between 200 and 500 were 4 of those. And so, okay.
Thank you for your report, Mr. Adams, which would take us down now to actually the closed session. It is now 1:59. Y'all want to take a short, due to the time restraints of some of the people that we have, you want to take about a 5-minute, and then we'll come right back and get 2 minutes, all right? We got a 2 to 5 minutes per Mr. Bose. We'll take a 2 to 5 minute recess, and we'll come back and handle executive session. Thank you very much. All right, thank you. All right, thank y'all very much. We will I'm sorry about that. Well, if you didn't have to deal with this, 5, 4, 3, 2, 1. Thank y'all very much. We will now reconvene in open session at roughly 3 o'clock. I appreciate your attendance here today. I know we have one matter left, and I would certainly entertain a motion regarding privileges. I have a motion for approval, a second by Dr. Weber, a second by Mrs. DeBose. All those in favor say aye. Opposed, no. Is there any other business that needs to come before the board today? There being none, we stand adjourned. Thank y'all very much. Done.